Gupta. I work with CDAC. CDAC is Center for Development of Advanced Computing. We are an R&D body under the Ministry of IT and Communications, Government of India. So we have 11 centers across India, and we are headquartered at Pune. I'm from the Mohali Center near Chandigarh, and we have conceived this idea of mSwasthya, which is a project funded by Government of India in tune to the objectives of introducing technology amongst the masses. So when we talk about mSwasthya, we thought of various problems which are actually prevalent. So today in India, when we talk about healthcare, usually people visit the hospital only when they are suffering from a particular set of diseases. So that means people are actually focused towards going for curative care rather than for preventive care. So just to bring about a paradigm shift amongst the mindset of the people, we thought that we should design such a mechanism in which people are more aware about their own personal well-being, so that they take care of their own selves rather than depending on hospitals, because already there's a population overload and there's an infrastructural gap that exists in the healthcare delivery institutions. So we talk about professionals in scarcity, and then we also talk about equipments which are not usually available at all the hospitals. So along with this, we also have these lifestyle diseases which are quite prevalent in today's world, so which need to be addressed very soon, because if not controlled, then means we need to put in some mechanism which can help us put a full stop at these diseases right now and there. So with the rapid and the wide penetration of the mobile phones, we saw this as an empowering tool for resolving some of the healthcare issues which are very prevalent. So for this, we introduced mSwasthya. mSwasthya is a healthcare app store that we have designed. So this has various applications on health, wellness, and fitness. So the idea was to introduce self-care, so that people can start visiting the website and start downloading the applications which are available and maintain their own personal health, and introduce a mechanism in which they did not visit the hospitals, so that the visits are reduced manifold. The next is to enable digital inclusion of mobile technology, promote the use of mobiles amongst the users. Then was to enable continuity of care to generate by creating a personal health record. So that was another thing that we introduced by connecting all the applications together, so that you have a personal record which is more comprehensive than an electronic medical record. And then the last point is the context awareness quotient amongst the users, so that they can make an informed decision. Context awareness is primarily introducing local information to the people, so that they can make a decision suitable to the local needs of that. So if suppose I have a hospital which is nearby and I have an emergency, so I can actually quickly look into my application which are the nearby healthcare delivery institutions. So I can locate that, I can track that, and I can reach that place well in time. Similarly, I can also have a real-time consultation with the doctor, and if suppose there are certain abnormalities which are reduced or which are which occur at a given point of time, the doctor would know the exact location of the patient, so that he can reduce medical intervention in an emergency mode. So that's where we could talk about context awareness, which has been introduced in mSwasthya. So these are the set of applications that we have designed. There's some of the applications which are part of it. We've designed more than 20 applications, and we're designing more applications and reducing it on a daily basis. So as you would see, we talk about consult a doc, primarily talks about consultation between the patient and doctor. Then we have lifestyle-oriented applications of BP monitor and diabetes monitor, so it tracks the blood pressure and the glucose levels. Then we also have the hospital search, which I was talking about, a context-aware mobile app, which tracks down all the hospitals which are there in the vicinity, so you can actually track them down and go there and visit those hospitals if in case of an emergency. And another interesting app is the OPD schedules, which lists down all the itinerary of the doctors, the OPDs of the various specialties, super specialty clinics which are there. So we did this for Chandigarh, so it was a quite hit that time, and people actually appreciate the idea, because if I had to visit a hospital, I did not know this particular doctor would be available on a given day or not. So this helped me know and gave me a better informed decision whether I should visit the hospital on a particular day or not. Likewise, I have this mSwasthya CS, which is like child immunization alert system, sends in alerts to the parents who have children up to 5 years of age, as recommended by the Ministry of Health and Family Welfare, for immunizing their child. So these alerts are sent in form of SMS, emails, and push notifications. Then we have this medicine monitor, which reminds the patients when and how when to take the medicines on time. And likewise, we have these tracking applications, cycling, walking, which helps to identify the activity, the type of activity that one is conducting, and you can manage your own health accordingly. So that's the architectural diagram that we have here. So as you would see, all these applications are connected with the backend. So we have created these web services which are interacting with the backend database, the mSwasthya database that we talk about. So it creates a user management portfolio and creates a patient health record. So the patient can access the health record online on mSwasthya.in, and then all these applications are interconnected. Though they're independent also, you can download them and use them individually. But if you are creating an mSwasthya ID, then you can connect all the applications and generate your personal health record. And then another thing I would like to introduce is the SMS gateway. The SMS gateway, which has been designed by Government of India, that's the Mobile Seva. Again, our CDAC counterpart in Mumbai have designed this SMS gateway. So we've integrated this into our mSwasthya application, and we are sending free SMS to the patients and to doctors. As I said, these applications are available free of cost on 3 forums. These are like mSwasthya.in, then the Government of India's own app store, that's the mgov.gov.in, and the third is Google Play Store. So we've actually seen more than 8,000 plus downloads in a short span of time. So actually, without doing any marketing, actually CDAC does not have a mandate to market or to publicize these applications. So without doing anything, so we already witnessed about 8 to 10,000 downloads. So what the impact has been that it has brought about a behavioral change amongst the users. It has encouraged the transition from curative care to preventive care, and it has empowered people to make a more informed decision. That's all from my end. Thank you so much.
Thank you. Thank you, Mr.